Welcome to the Pegasus Learning Platform. Pegasus is your home for clinical simulation and learning resources. This quick timeout is for short study breaks and will cover dawn phenomenon and Somogyi. Dawn phenomenon and Somogyi are conditions experienced by people with diabetes mellitus. There are similarities in blood glucose levels, early morning hyperglycemia, etc. The treatments are vastly different. In fact, the treatment for one of these conditions may seem counterintuitive until we understand the pathology of the disease process. Some of the similarities include normal or elevated evening blood glucose levels and early morning hyperglycemia. There are some differences. With dawn phenomenon, the blood glucose around 2 or 3 a.m. is normal or elevated, but with Somogyi, the blood glucose around 2 or 3 a.m. is actually low. With dawn phenomenon, there's no release of counter-regulatory hormones, whereas with Somogyi, there is a release of counter-regulatory hormones. With dawn phenomenon, the blood glucose is elevated due to a steady rise. With Somogyi, the early morning blood glucose elevation is due to a rebound effect. With dawn phenomenon, there are no night terrors, whereas with Somogyi, there may be night terrors and nightmares due to the sympathetic or adrenergic response. The treatments are different because the causes are different. With dawn phenomenon, we need to prevent the blood glucose elevation, whereas with Somogyi, we need to prevent the drop that results in the rebound effect. With dawn phenomenon, they might need more insulin at night, whereas with Somogyi, they might need less insulin at night. With dawn phenomenon, there's no increase in the evening snack, whereas with Somogyi, we might need to give them more food at night. So remember, with dawn phenomenon, the blood glucose rises like the dawn. With Somogyi, sometimes low, sometimes high. With dawn phenomenon, we need to prevent the rise in blood glucose, whereas with Somogyi, we need to prevent the drop in blood glucose. With dawn phenomenon, there's generally no night terrors, whereas with Somogyi, they may have night terrors or nightmares due to the sympathetic response. The healthcare provider will need a 2 a.m. or 3 a.m. blood glucose check to identify if it is dawn phenomenon or Somogyi. Please note that this is a brief overview only. This quick timeout is for short study breaks, and dawn phenomenon and Somogyi involve more than this QT covers. You can find more information in your course on the Pegasus Learning Platform or ask your instructor for help. Thank you for your attention to this resource hosted on the Pegasus Learning Platform.